Correlation between frequency of applied behavior analysis intervention and improvements in deficits found in autism spectrum disorder, a novel research proposal. By Brandy Richter, Department of Psychology, Liberty University. Autism spectrum disorder, or ASD, is a neurodevelopmental disorder that profoundly impacts an individual's life. ASD is characterized by deficits in several areas, which include reciprocity in social communications and interactions, restrictive and repetitive behaviors, interests, or activities, language and speech deficits, gross and fine motor deficits, and deficits with nonverbal communication. However, all of these characteristics do not have to be present for one to be diagnosed with ASD. There are currently 3 diagnostic levels listed in the DSM-5 for ASD. Level 1 requires support. In this level, one may have difficulty understanding and following social cues. They may appear uninterested in social interactions, and they may have difficulty transitioning from one activity to another. They also may show difficulty staying organized and with planning. Level 2 requires substantial support. It may be displayed as having limited social interactions. They may have high interest in a specific topic or item. They could have difficulty with verbal and nonverbal communication, and they may display repetitive and restrictive behaviors more frequently than in Level 1. Level 3 requires very substantial support. One with this level would display severe communication deficits, such as being nonverbal. They may prefer to have solitary activities, and they show extreme distress when transitioning from one activity to another. Applied behavior analysis. Applied behavior analysis, or ABA, is one form of treatment for the deficits seen in ASD. ABA uses methods such as positive reinforcement, discrete trial training in which skills are broken down into smaller increments, antecedent interventions, extinction, and prompt fading. ABA can occur in a variety of settings, such as in clinic, in home, community-based, or even in a school. ABA therapy is performed by a paraprofessional or a registered behavior technician. It can also be performed by one designated within a school system. Registered behavior technicians are supervised by a board-certified behavior analyst, or a BCBA. Although there is ample research that ABA treatment can have a positive effect on the deficits seen in ASD, the amount or frequency of the treatment does not have ample research. This proposal hypothesizes that there is a positive correlation between the frequency of treatment and improvement in ASD deficits. Social interactions in one with ASD can be a source of great anxiety and stress. Previous studies have shown that there are several ways that an increase in stress can be monitored, such as increased heart rate, increased perspiration, and an increase in spontaneous eye blinking. In times of anxiety, the eye blink rate can dramatically increase. However, research on ASD and stress-related eye blinking seems to be lacking. Eye blinking may be an identifiable way for those who administer treatment to ASD clients to identify anxiety early. Therefore, the second hypothesis for this proposal is that eye blink rate will have a positive correlation with ABA therapy at the beginning of the study and a negative correlation at the end of the study. participants. 100 participants will be selected using convenience sampling from local schools. A questionnaire will be sent home to parents of children who have an individual education plan or IEP on file. Participants will range in age from 6 to 10 years and include both male and female students. Participants must have a formal medical diagnosis of ASD. Participants must be actively participating in ABA therapy that is being conducted by a registered behavior technician or one who is designated within a school to provide ABA therapy. The design. The study is a two-part study over an 18-month period. A correlational research design will be used for both Parts A and Part B. Measures will be repeated at 6-month intervals. Part A independent variables will be the frequency of ABA services and learning indicated by the overall improvement of deficits. Part B independent variables will be frequency of eye blinks and social interactions. Measures for Part A. The Villain Adaptive Behavior Assessment 3rd edition will be used to assess communication skills, activities of daily living, social and relationship skills, physical activity capabilities, and maladaptive behaviors. This will be performed on the participants by a BCBA or a qualified assessor within the school. There is also a portion that is given to the teacher and the parent to fill out independently. Part B. Eye blink rate will be measured through naturalistic observation and recordings. Baseline blinks will be taken for participants before being placed with a group of other participants. Participants will be randomly divided into similar age groups of 3 to 5 participants. Areas used will only contain participants and age-appropriate items. Cameras and researchers will be set up strategically around the room. Eye blinks will be recorded for 1 minute over a 10-minute period. The recordings will take place at the start of social interactions, at 3 minutes, 5 minutes, 7 minutes, and lastly at 10 minutes.